We had a bone symposium talking about the remodeling markers and their use in clinics. We have 3 speeches in that symposium. In the first one was reviewed by Dr. Paweł Sulsk, the clinical use and the systems to take good sampling and good measurements of the bone markers in the everyday practice. Afterwards, Professor Etienne Cavalier was explaining the new results on the standardization of the different methods for measuring the different bone remodeling markers that has been carried out in several European countries, cross-calibrating the performance and the accuracy of the measurements, comparing the results obtained by different techniques in different laboratories. And the third talk was about the use of bone markers for screening adherence to the treatment, in particular with oral bisphosphonates that, as we all know, it's a quite challenging problem because the rates of persistence on treatment after 1 year for these drugs is always below 50%. And the proposal that has been published already by a working group of the IOF is to measure at baseline 2 markers, the most widely recommended markers, P1NP and CTX, and repeat the measurement 3 months later when the patient is supposedly on treatment. If the bone markers decrease beyond the least significant change, we can be reassured that the drug is working and the patient is taking the drug. Therefore, we can certify that the adherence is correct. If it's not the case and there is no decrease in such a degree, then we have to investigate first if there is some problem with the medication, most commonly that the patient is not taking the drug, and if still the adherence looks okay, we have to investigate for some secondary cause or some other medication that is interfering with the absorption of the bisphosphonates. With that, we have a clinically useful and feasible strategy to detect those cases that have a withdrawal of the medication, that they stop taking the drug. And we know that this occurs most commonly in the first few weeks after the prescription. With that, we can have a very useful tool for improving the adherence and at the long run for improving also the cost efficiency of the drugs, because a drug that is not taken, that the patient simply doesn't work.